Hello, and welcome to the second episode of our podcast, What Rubbish? A Holistic Approach to Breast Cancer. With me again is the founder of the Alka Ori Foundation, Ajay Ori, and we're going to take you through this journey. We finished our first episode giving an introduction about Alka Ori Foundation and the purpose of the foundation. So,
Hello,
Ajay,
Kumar.
can you do a refresher? Let's quick refresher of what is the purpose of our foundation? Yeah.
Hi, Kumar. Great to be here again. And hopefully, the first episode that we did for What Rubbish gave an insight of what we are doing. And just to kind of refresh, the purpose of this podcast that we are doing is to provide knowledge, bring awareness to women so that we can reduce the risk of breast cancer globally. And I think today our discussion is more related towards understanding the gaps.
So there is the traditional approach.
Yeah.
And then there is what you're proposing. We're not trying to cure cancer. We are trying to reduce the risk, for example, of somebody getting it by using preventive techniques, and also we are trying to make the journey comfortable for somebody that's already diagnosed.
Which is more important, yeah.
That's more important.
that's
so,
more important,
so
yeah.
tell me what are the gaps? What are the gaps? What do you see in traditional that's missing?
I think during the course of last 5.5 years that when my wife went through, we realized after the fact that there were some gaps due to obvious reasons where there was no good follow through towards the holistic approach. In fact, it was not highly encouraged or enforced, I would say, for a better word, at these centers. And I think we ought to keep that in proper perspective when women is going through the treatment, that they also need to be encouraged with the holistic approaches, such as diet, exercise. Obviously, diet is encouraged, but I think there's no follow through on it. Number two, exercise. I think women who have cancer, breast cancer, they are mentally tortured. They are tortured means psychological impact is very strong, and they may not do it on their own. They need help. And I think if there is a help coming from the cancer institutions, that would be very helpful. Now, I could understand the challenges from their perspective because that requires a lot of resources, and these resources have to be paid, and insurance companies don't reimburse it. So I don't know why the cancer institutions will not add more resources to support and make the life of these patients more comforting. In fact, the expectation is that the patients need to make their own arrangement. So I think it becomes very difficult for the patient to make their own arrangements to support in these areas.
Of course, you're the expert, subject matter expert, I guess. Where is the actual gap? Because I know that even cancer organizations, right, MSK, they have these integrative
Oncology groups.
groups
Right.
that their goal is to introduce some element of these holistic treatment. Yes, so
They should. Now the question is, are they brought into that picture? I did not see that with my wife. And I realized that the integrative oncology group is very strong believer in the holistic approaches in conjunction with the chemo treatment. What I saw with my wife was that she was going through lab test, chemo, doctor's appointment. On the other hand, she was told that you should do walking, do some diet, and watch from the sugar. Do not eat any sugar. Do not eat any processed food. Blah blah blah. But I also feel that if there was a one-on-one help, where the nutritionist is calling and itemized the areas, what are the do's and don'ts in the diet, I think that should have been helpful, but it was not the case. Same thing with the yoga, meditation, and all that stuff, which is part of the holistic area, was not really reinforced, and I had to help Alka myself to go through that process.
so you were not aware, for example, that MSK had this resource. That,
Yes, I was not aware. Yes,
Integrative
I found out after
oncology.
the fact. Yes.
And you have been talking to people in these institutions, and they acknowledge that there is a gap. Yeah.
After speaking to several oncologists, they realized that they also believe that there is a gap, And I think they're trying to minimize that gap as much as possible. But I think we need to do a lot more.
Is it just a communication issue that there is an integrative oncology department and then there is treatment going on in the same hospital? So
Yeah,
do they not know about each other, or they're not promoting each other, or is it a
that
resource issue? What is
that
it?
that's a very good question, Kumar. And I think I don't know the exact answer, but I can make an assumption. And that assumption is that maybe these groups are not interactive with each other. Maybe they are two different segments, which they are, and the purpose could be different. But I think within the breast cancer area, I think they have a common goal where they want to eradicate the disease. And but I think there has to be some level of communication that has to happen, and which I assume is whether it's there or not. But in my wife's case, obviously it was not. So I think that's where my concern lies.
So is your goal, for example, I'm just trying to clear in my mind
Yeah.
also, is your goal to just activate that relationship between these two departments that already exists? I mean, which means if the integrative oncology department were to work closely with the doctor administering the chemo, you think it'll all work fine, or there is still something missing that Alka Ori Foundation will fill the gap there?
So I think there are a couple of components. There are one component that I'm focused on also is the fact that the women who don't have breast cancer but they have a family history of breast cancer. I think these women are needs to be they need to be educated, made them aware of some of the risk factors that they can minimize. That's one factor. I think that's something that Alka Ori Foundation wants to proactively promote. Number two area is where these women have breast cancer and they're going through treatment. This is where the integrative oncology group can play a very important role, which I don't know to what extent they participate in with the medical oncologists who are really treating them, because integrative oncology group are located at their main centers, but do they have at their satellite offices, do they have individual who can support them? So I think that's a question that once I talked to one of the heads of the Society of Integrative Oncology Group, that would give me a better answer to that. But I certainly feel that there is a gap.
Okay, but do you even know what they do? What offerings there? What do they offer inside the integrative oncology
To my
group?
understanding is, see, I will be bringing the one of the research leaders in the integrative oncology groups. And I think these will
Neil
be
Iyengar.
Neil Iyengar and Jennifer Lejabel. We're going to bring them on one day to the podcast, which I think would be a very valid question to ask them and hear it from them as to what they feel are the missing links in between their own institutions. I think they're trying to elevate their noise level. They're trying to elevate that there is no one set way of treating breast cancer. There has to be a combination, and I think that's what the holistic approach makes a lot of sense. Having a better diet, having a proper nutrition. What are the do's and don'ts in the nutrition? Number two is yoga and meditation is very important.
See, hold on for 1 second. Nutrition. Let's get back to nutrition,
Yeah.
because we are family.
Yeah.
Again, Ajay is my brother-in-law. was a dear my sister-in-law, and Ajay's wife. I just remember bits and pieces because you were the ones that was bearing the brunt of it. Of course, my wife too, Ilka's sister, the whole family was. But in terms of nutrition, what was the gap there? What was the doctor? And a doctor is competent; they know what they're doing. And are they overwhelmed? What was the message she was getting from the doctor versus the nutritionist? Was that in sync, or is there a gap there also?
I felt that they have a nutritionist on board, but there's one nutritionist, in my opinion, at one side where there are hundreds of patients coming in. So I don't know whether the nutritionist was enough to help all the women who are suffering from cancer. I think what I also found out was that it was a simple PDF document that they gave her. Okay, just use this as a diet. But I think everybody's DNA is different. Everybody's eating behavior is different. I think the nutrition piece has to be customized to that individual, and I think I felt that was not there. And a follow through is very important because I know that takes a lot of time and it requires money to add the resources to that. But I think we're dealing with people's lives. We are dealing with these life-threatening diseases, which ought to have these type of resources made available. If not the hospital or an independent nutritionist can come on board, but that is required. And I think that direction was not fully clearly defined, because medical oncologist, in my opinion, is not a nutritionist. And there is itself was a difference of opinion between what the medical oncologist was communicating versus what the nutritionist is communicating. So I think those gaps have to be unified as to one message going out to the patient, so that they're not confused going back home. It was very evident that no sugar, no processed food. But I think in addition to that, there's a lot more stuff. What are the greens you should take? What are the greens you should not take?
Also, it's not just, we are talking about breast cancer, but this is true for any kind of cancer,
Yeah,
right? Right?
absolutely.
So even though you're focused there because of the experience you went through, because you got to start somewhere,
Right.
This kind of holistic treatment is going to be applicable to everybody. Is it different for different types of cancers, or,
Not really, because cancer is cancer at the end of the day.
Yeah.
But the location of the cancer defines what type of cancer it is in the body. So I think, but the holistic approach applies to all cancers. And I think it's very important. Yesterday I had a call from a lady whose father is suffering from gastric cancer. I'm not the expert. My recommendation is go and talk to the specialist in that area. However, the underlying methodology still remains the same from a holistic point of view. And I think that is something that we all need to adhere to have a healthy living on a day-to-day basis. We've got to put down those foods which are not going to make us feel better. Okay. And I think the greens are very good. They are organic and they are healthy, and a proper set of food supplements have to be included in their regimen, which is also very important.
And you were saying that even food supplements, there's a difference in the way, for example, the doctors' attitude towards food supplements, the East Coast of US versus the West Coast of US.
Yeah, the doctors in the West Coast, they believe that food supplements are fine, but East Coast doctors, they believe that they should not have food supplements because it can potentially prevent from killing those cells which are cancerous, because the food supplements can block them. Or they might be having some interaction. But I think it's a myth. It could be a myth. I don't know whether that's a proven fact. It could be a fact to one degree, to one extent, where some food supplements could have an interaction with other.
It depends on what food supplement. Too.
Right.
What supplement manufacturing, how they're made. Yeah.
Right. Okay. So I think it's a very general statement that I'm making, but I think we have to dive deep into more. I think Alka was taking D3, which is very good, okay, because that was recommended by the doctor to take. But I think a lot of food is basically metabolized through the liver. And I think it is very important that liver has to be protected, because liver extract is very good. Vitamin C is very good, in my opinion. So I'm not expert in nutrition or in cancer. I think it's very important that they go to the right source. Patients need to go to the right source to get the right information, in my opinion. And what we want to do is, at this platform, is bring those experts who can probably bring to their attention some of the do's and don'ts in that area.
So one thing is for clear, Ajay. Your work is cut out. The work for Alka Ori Foundation is cut out. We can identify definitely.
Right.
So we're talking about gaps of general overall traditional versus holistic. Then gaps within these organizations, where we can help the communication, and gaps within, in the sense that we also have to identify what they already have.
Right.
That's not even clear between. Sometimes it happens in big organizations. The left hand doesn't know what the right hand is doing. So we have with the Alka Ohri Foundation, you have a lot of opportunity lot of gaps to fill, and some of them are right under our nose. They're obvious, right? But somebody needs to address it, and I think it's a very noble cause. And I'm glad we are on this journey. I'm sure as you're speaking here too, you're going to get responses. You're going to get interest from people. You'll be able to learn more and even contribute to people. Although as it is, everybody's calling you now.
Well, it is. And Kumar, I see there's a lot of controversy in some of the things that I have experienced, or I would say I have seen and heard from folks. I think the pharmaceutical industry, I think, needs to look at this thing very intrinsically and in great detail as to how they can bring the holistic measures in their day-to-day course of treatment. I think it may not be enforced by them, but it has to be enforced by the physicians. I think they need to become aware of this. And I think our objective through this platform, from What Rubbish platform, is to kind of provide what's out there, what questions the patients are having in their mind. We want to bring those questions into proper answers for them so that they can get right answers for themselves, so that they can take care of themselves, they can be safe and prevent themselves from having cancer. And patients who are going through, they can solve the problem of their cancer as quickly as possible, or their journey becomes quite comfortable, because the overall goal is how can we improve the quality of life for these women who are going through these treatments.
Once again, this is fantastic. I believe that we are moving along great with this podcast. Thank you for all the work that you're doing. I am very positive that this is going to impact hundreds of thousands of lives in a good way, making life comfortable. Like you said, that's the most important thing for people that are already diagnosed, and once again, What Rubbish, that's the name of the podcast. That is a very, very signature Alka statement, Alka Ori statement, because she was full of life, extremely vibrant, full of energy, and she had no problem expressing her disagreement or dislike openly, anywhere. So she would say what rubbish to a lot of things, anything, a lot of things that are going on in the news. Maybe in this whole situation, if she was here, she would be telling the doctors what rubbish. Okay, so we are here. Thank you for this. Thank you for listening, everybody.
Yeah.
And Ajay will get ready right after this for the next podcast, and we'll
Right.
see you then.
All right. Thank you so much, guys.